Today I'm talking to Dr. Nancy McWilliams, who's made a vast number of accomplishments in the field of psychology and more specifically in the field of psychoanalytics. Amongst other things, she is a renowned psychoanalytic author, teacher, supervisor, and therapist. She's also a former president of the Division of Psychoanalytics or for Division of Psychoanalysts. I've been interested in interviewing Dr. McWilliams for some time because, in my opinion, I think she has the best understanding of schizoid dynamics that I've come across thus far. I could go on, but I'll let her introduce herself. So, Dr. McWilliams, would you like to introduce yourself?
Sure. I think probably the most important thing to know about me is that I'm a retired professor of uh, clinical psychology at the Graduate School of Applied and Professional Psychology at Rutgers. I taught there for 40 years, um, but mostly um, I'm a practicing therapist. That was a 1 day a week academic position. And I've always wanted to work with a very wide range of people. My PhD is in personality, and from the time I was very small, I've been very interested in individual differences, not just personality disorders, but
Mm-hmm.
personality types, and even things that aren't personality that distinguish between people, like um, age differences, ethnic differences, racial differences, whether you're a twin, whether you're an adoptee, whether you have some kind of neuroatypicality. So I have found that psychotherapy, um, if one is to be effective, the best way is to really try to get inside what it's like to be the particular patient that you're trying
Mm-hmm.
to help.
Yeah, that makes a lot of sense. Yeah. Well, today, I particularly wanted to talk to you about schizoid adaptations, and I was wondering if you could give like a general sort of explanation of what you think it means for a person to have schizoid adaptations.
Well, people with schizoid dynamics um, are vulnerable to feeling intruded upon, impinged upon, penetrated. They feel a little bit skinless. Um, Norman Deutsch talked about uh, schizoid people as suffering from hyperpermeability. In other words, things get inside them too
Mm,
easily. They're exquisitely sensitive people. And so they need adaptations to the challenges of life that can come at them too much,
mm,
too fast, too heavily, and they need essentially ways to preserve their personal space so that they feel that there's a little bit of a moat around their castle. Otherwise, they feel too intruded upon all the time. Um, and contrary to what the DSM says, because that's all based on what's externally observable, schizoid people feel things very deeply. They're not dulled down. They suffer usually from what a very good friend of mine who has a schizoid psychology calls um, proto emotion. Like they can get overwhelmed with emotion, and so they have to manage their internal reactions to things, and at the same time try to keep enough distance from the things coming at them that they're not overwhelmed. So schizoid people have numerous adaptations to this. Sometimes they're a little bit quirky, and it's different from eccentricities in other people. Some people uh, are a little bit eccentric because they don't really understand social norms. Schizoid people are sometimes a little bit eccentric because they don't want people to to be all over them, you know.
mm, mm-hmm.
So if they wear a peculiar hat all the time, or if they always sit in the very back of the room, and that means people don't approach them as much, that's fine with them. Um, I have a schizoid friend who I acknowledged in one of my books as having been very helpful to me. And I gave a talk in his area, and one of the therapists in that area said, "How do you know him? He's we all know he's brilliant, but he's frustratingly reclusive." Um,
Mm.
and so I told my friend that that had been said to me, and his
Mm-hmm.
reaction was, "Where did they get brilliant?" He didn't mind being frustratingly reclusive,
Yeah.
but he didn't want to be seen as brilliant because that might bring a whole lot of people in his direction. So
Right. Yeah.
that's a very different and it's not insignificant that he practices way up in an area of the country without a huge number of professional meetings, and it's not a center of clinical practice, but it's where he feels in control of his time and his space, and where he can work with the patients that he knows he can help under his own schedule. um, I think one of the things that's happened to me since I wrote a chapter on schizoid psychology is that schizoid people, or self-diagnosed schizoid people, have written to me saying, "Thank you for understanding what it's like to be a very
Mm-hmm.
sensitive introvert like me. Let me
Yeah.
tell you some of the ways I try to manage the overstimulatedness of my life." And they'll describe things like, they can listen to a lecture if they, surround themselves with empty chairs so that they don't feel like they have to deal with friendly people on either side of them. It's not that they're
Mm-hmm.
not friendly, but they just are too easily over intruded upon. Some people rock, some people go into their private closet, some people go out in nature to get away.
Mm-hmm.
They have very different adaptations, but they all manage the problem of um, not being overstimulated, impinged on, and intruded on.
Right. Yeah, that just makes a lot of sense. It sounds like, in other words, that schizoid individuals feel the need to put up a front. So, in one sense, to ward off people because they don't want too much impingement and overstimulation, and in other ways to stop themselves from being overstimulated. And
Yes, one of my friends talks about passing. I pass as a sociable person,
all right, yeah,
but
yeah,
I'm really not. I mean, it's not that schizoid people don't have close friends. They usually have a couple of very close friends, or if people are just too much for them, they're often very close to animals, maybe horses, maybe other pets. Um, they love their
right.
children very deeply if they have children, but they don't want to be um, engulfed in sociability.
And you talked about feeling very deeply. Do you think that for some schizoid individuals, because um, we feel very deeply, that we have to cut our emotions off, and that sometimes we can get stuck in the state where we're not really feeling, but it's not because we're incapable, but it's just because we put up so many defenses to our own feelings?
Yes, many people have described that to me.
Mm,
It's a kind of dissociation. In
right.
fact, that's where the term comes from, the term schizoid, that there are schisms between, on the one hand, feeling things very deeply, and on the other hand, looking very non reactive, or feeling internally preoccupied with issues of violence or aggression, but looking on the outside like a very shy, quiet, peaceful person, or being very interested in sexuality, but not looking at all like you're trying to be seductive. There's a schism between how one feels inside and how one chooses to present to the world. And sometimes those things do sort of get a momentum of their own, so that sometimes the schizoid person feels, I can't get back into the, the enlivened life. I'm kind of stuck here in a dissociated state.
Right. Okay. Do you do you think that it's useful to use the label of a schizoid personality or a schizoid individual to label people who have schizoid adaptations? Because some people are against labeling. They think that it sort of puts people into a box. But do you think it
Yeah,
has its uses?
labeling's inevitably a problem when you objectify people like that. But the
Mm,
problem for me, who has to teach therapists about differences among patients, is that we have to have some language to
mm-hmm.
generalize about, you know, or
What we're talking about, yeah.
basic differences, you
Yeah,
know.
yeah, that
Um,
makes sense. Yeah,
so
that's true.
and when calling somebody schizoid doesn't mean you're saying they have any kind of disorder. I mean, I'm a more hysterical and depressive person, and I don't think I have a personality disorder. Those are just my dynamics.
Mm-hmm.
Some people are more obsessional. Some people are a little bit paranoid, but they don't have a personality disorder. That's just, they're organized around a different theme. The theme for people with what has been called schizoid psychology is always how close and how distant
Mm-hmm.
should I be? Closeness and distance is what preoccupies them, as opposed to, let's say, obsessional people who are preoccupied with issues of control and discontrol, neatness, messiness, um, or paranoid people who are preoccupied with uh, threat, trust and distrust, um, or narcissistic people who are preoccupied with being idealized or devalued, and they worry about those issues. So all of the personality types, as terms have arisen about them in the community of people that try to help people with their suffering,
Mm-hmm.
can sound very pathologizing, but they
Mm-hmm.
don't have to be pathologizing. And certainly
Mm-hmm.
we all have psychologies.
Yeah, I think people are starting to realize more that like they come in understanding schizoid personality disorder from the DSM-5, but then
Yeah.
when they look into the psychoanalytic theory, they see there's a lot more broader spectrum to the condition, and that there's people who, because what concerns me is that there's people who are on the schizoid personality spectrum who are never going to really discover this, because when they look at the DSM-5 descriptions, they're like, well, this isn't me. But at the same
Yes.
time, they could benefit from assistance with their schizoid issues. Um,
Yeah.
but it's just difficult for them to find a way into a position where they can identify themselves as
Yes. The
mm,
DSM since 1980 has been particularly bad on describing schizoid psychology because in 1980 they went to trying to describe everything so that a researcher looking from outside could observe it. And the important thing about schizoid psychology is the outside can look pretty different from what's going on inside.
mhm,
And when the DSM says that schizoid people don't really care about getting close to other people, that's just crazy. I mean,
mm,
it may be that a particular schizoid person has been so wounded by relationships that he or she has given up. But we are all mammals that start out needing to attach. And even the most severely schizoid people that I've worked with over a period of time find in themselves the part of themselves that wants to be close to somebody.
mm,
So that's not just a emphasis, that's outright wrong in the DSM.
Yeah, I think as well that for some schizoid individuals, especially when they have no previous experience of having any sort of human connection or bond with another human, may feel that like it's too much to ask, like it's an impossibility, that because it's hard to imagine that really becoming a reality for them.
Yes, yes,
Mm,
I know that's true.
yeah. And I was thinking about Guntrip's 9 core schizoid traits. Do you think that this is a good representative of the schizoid personality in terms of criteria to identify people with schizoid traits?
Yes, I think Guntree knew about this psychology from the inside. I suspect
Mm-hmm.
this was his psychology. And I find his description much better than the trait descriptions that you
Yeah.
find
Mm-hmm.
in, in most of academic psychology.
Yeah.
I don't remember the 9 qualities, but I was
But
trained on Guntrip.
yeah, when I
Um,
saw the gun trip, I immediately felt a greater resonance with what was written there
yes.
than anything I'd seen anywhere else. So
It
yeah.
opened my eyes to a whole way of being in the world, um, for which I'm
Hmm.
still grateful to read that book.
Yeah, agreed. And I wanted to ask, why do you think that schizoid adaptations is not more popularly known in society in general?
Well, we live in a culture that emphasizes extroversion.
Mm,
Um, there have been a few books uh, protesting this. For example, Susan Cain's book, Quiet,
mm,
um, The Power of Introverts in a World That Can't Stop Talking.
mm-hmm.
But, or The Highly Sensitive Person, that book.
Yeah.
Um, and there are a few others too, where more introverted people protest that, they have a perfectly reasonable psychology. But most Western psychologies have put a lot of emphasis on being a good salesman and going out there and, impressing people and developing your image. Those are not things that interest schizoid people.
Mm-hmm.
So I think part of it is cultural. There are cultures that are much friendlier to schizoid adaptations. Um, Certain Eastern cultures, for example, certain native and tribal cultures, and they often have valued roles for people who are highly sensitive and introverted and intuitive, like schizoid people. But I think one of the reasons we don't appreciate schizoid adaptations is that in this culture we emphasize getting along with other people and the
Mm-hmm.
herd mentality. And even though we complain about it, like I grew up in the 50s where everybody was saying, this is a conformist culture and conformity is a problem. It hasn't stopped. We
Mm-hmm.
complain about it, but it's still, in fact, if anything, it's worse now with the internet, with people feeling like if they put themselves out there, they're going to get overwhelmed with ideas about what you should do and how you should be and how you should present yourself. Uh,
Yeah.
so, I mean, one of the things that has always attracted me to schizoid people, and I have to say, the people I've most deeply loved in my life, my first husband, my second husband, a couple of my supervisors, and my closest friend have described themselves as schizoid. And the reason I love them is their integrity. Um, they they have an honesty. They are not internally false. They may have a false self presentation, as you described earlier,
Mm-hmm.
but um, they have radar for emotional dishonesty, and they can't go along with the pressure to just um, behave in a way that doesn't feel genuine to them. They
Mhm.
tend to be miserable at cocktail parties or other uh,
Mm.
situations where chit chat is required.
Yeah, small talk is like, yeah. I think I think for a lot of schizoid individuals, we're sort of like bigger picture thinkers. So
Yes,
because of the abstraction and the ideas and theories and
yes,
concepts, so sometimes it's a bit difficult to like come down to earth and be like, oh, do you think this sandwich is better than that sandwich? Or, just so
yes.
everyday sort of things that people will deal with. Like, yeah, for sure.
Yeah, there
Um,
was a philosopher in ancient Greece that Aristophanes used to make fun of in his plays named Thales. And the joke was that Thales was always falling into wells because Thales was thinking his great thoughts and he wasn't paying attention
uh,
where he was walking. So periodically people had to rescue Thales from some well that he had fallen into. And the
that's funny.
absent-minded professor is one of our cultural images of a schizoid psychology.
Right. Yeah.
Einstein describes himself in ways that are clearly representative of a schizoid psychology. He talks about how he's never really felt part of any community or even family quite
Mm-hmm.
fully. You know? And
Right.
he just spent all his time thinking his great thoughts. And yeah, coming down to what sandwich you want is a little bit jarring if that's where you're spending your time.
Yeah. Yeah. Um. Uh. Yeah. I was. When I read your paper, there's a lot of things that I resonated with and that I liked. One of the things that we sort of touched on a bit today is how a lot of schizoid individuals live on like the fringe of society and like kind of like the unknown minority that sort of amongst us that probably doesn't really get a lot of attention, and also that a lot of schizoid individuals can be afraid to be stigmatized
Yes.
through diagnosis and things because they recognize that what's going on inside them is very significantly different from what
Mm-hmm.
they see other people, how what's going on with them in terms of behavior and thought processes. And we can think that we could have a form of insanity that, if we get found out, like something bad could happen to us, and that feeds into the
Yeah.
safety defenses as well.
Yes. And many people who struggle with being especially schizoid were given messages that there was something wrong with them. You know,
Mm,
I think there's a very strong biological component to being schizoid. There are some babies that's been noticed at least since the 1930s. Some babies respond very strongly to light, to sound, to changes of how they're held, to labels in clothing. I mean, they're just extremely sensitive. And most babies cuddle up to you, but
mm-hmm,
some babies will sort of stiffen and pull away as if it's overstimulating them to be swooped up.
mm-hmm,
Um, and, so it's not an easy temperament to have to be that sensitive. But if on top of that, everybody in your family says, you're too sensitive, you're just exaggerating, what's
mm-hmm,
the matter with you? Go hug your aunt. Then you
mm-hmm.
feel like not only are you sensitive, but there's something wrong with being sensitive.
Mm,
And a lot of schizoid people suffer greatly from the sense that if they say what's really going on with them, the non-schizoid people are going to say, "Ah, boy, you're a weirdo,"
mm,
and they're not entirely wrong about that.
mm.
They have to choose carefully the people that they show themselves to.
Yeah, it's true. It's true. I think as well because it's not widely known about in society. Like for example, something like autism, you could say to somebody like I'm autistic, and a lot more people would understand what that actually means.
Yeah,
But not only do we, a lot of us don't really even know we are schizoid to start with. Even if we did know the word, if we said it to somebody, it wouldn't
yeah,
really mean a lot to them. You know. So
yes.
it's like that. But I think really primarily, I think it's more important for us to understand ourselves, because I think that goes a long way. And I think like your paper, for example, on Schizoid Dynamics, it showed a lot of when I read it, I found that it resonated a lot, really strongly
Oh,
with what I was going through personally, and it was helpful. I wanted to
thank
ask you
you.
specifically, thank you. I wanted to say specifically in your paper that you wrote about, you said that INFJ is one of the most common um, Myers-Briggs
Yeah.
personality types for to develop maybe schizoid adaptations. And what do you think, in your opinion, may be the reason or link between that personality type and having schizoid adaptations?
That's the introverted, intuitive, feeling, judging
Mm,
person. Those are Jungian concepts that got
yeah,
uh, reified in the Myers Briggs personality inventory.
right,
Which
yeah,
I have liked that inventory because it presents personalities as having dynamics, not
yeah,
just a set of traits. I'm not an expert on it though.
mm-hmm,
Um,
right,
and what I reacted to in the description of INFJ was the people I'm most attracted to who have identified themselves to me as schizoid tend to have that version of it. I think there are other subtypes of it,
mm-hmm,
INFP perhaps, and
and
INTP.
INTP, yeah,
But I just have more experience with the INFJ.
mm-hmm,
There are a very small percentage, only 1% of people with the Myers-Briggs test INFJ, and
mm-hmm,
they are thought of sometimes as the mystics or the poets or the
mm-hmm,
seers because of their level of intuition. They often are people who think in images more than words. For
mm-hmm,
example, they see. They don't hallucinate, or unless they have a psychotic illness, but they see um, images that help them understand the world, and that's an
mm-hmm,
unusual way to. It's like some musicians hear melodies all the time, and some
mm-hmm,
schizoid musicians hear melodies all the time too. There's more synesthesia among schizoid people. Um, and I do think they have certain kinds of capacities that some of us don't have. Uh,
mm-hmm,
but you ask why it's not more recognized. Um, a conversation I had with one of my close friends who identifies with this psychology comes back to me. I, I, I asked about gun trip. This was I was asking about because even among psychoanalytic people, many of them don't know that much about schizoid psychology, even though Guntrip was a psychoanalyst and wrote a
mm-hmm,
very influential book. And I said to this friend of mine, um, why do you think we haven't kind of normalized this kind of psychology? Freud normalized certain kinds of sexual conflicts, and Heinz Kohut normalized certain kinds of narcissistic issues. Why haven't people latched onto gun trip and normalized the frequency of schizoid issues? And he smiled and he said, "You don't think we are going to start a movement?" So, in other words, it's not going to come from schizoid people because the whole
yeah, yeah,
generation is not their interest. Um, I
yeah,
could be kind of an ambassador for that community, but if I were, quite schizoid, I would find that torture to try to be explaining myself all the time to people who didn't get it.
yeah, definitely. I think that what I've seen amongst a lot of schizoid content creators on YouTube is we don't tend to really stay around so long, you know, because I think that the exposure feels unnatural, you know,
Mm-hmm.
like what you're saying, just even sort of putting yourself out into the world, it feels really odd and sort of against like the grain a bit, you know. So that's sort
Yes.
of like a hurdle I think that has to be overcome. And if someone is gonna as you said, like become an ambassador, or it's going to be a lot harder for us to represent ourselves because of the very nature of the condition that we're living with. So yeah, I
Yes,
do
I think
agree.
this program must be doing a great deal to raise people's consciousness about this kind of psychology. I'm very pleased to see that
Mm.
you have it going.
Yeah, I'm trying. It's like it means a lot to me because of having lived a long time without knowing. And I spent so many years trying to work it out for myself, trying to piece together like, why am I different from other people?
Yeah,
Why can't I become like part of the group? Why don't I enjoy doing the things that I see other people doing? So finally, well, for a while now, but to when I did get the word, and then furthermore, like reading work like yourself, it really helped to put the pieces of the puzzle in, to get to bring the picture together so that I could get more peace of mind, and I would like that for other people as well.
yeah,
Mm,
that's such a valuable service.
yeah. So I was thinking about schizoid individuals, like identifying with other people and particular in the company of other people, aligning with other people's needs and values. Do you think that is dependent on the level of functioning somebody is on, whether they, to what degree that they take on other people's, in the moment, other people's values, or copy other people's behavior, like mimicking, mirroring, like those sort of behaviors? And do you think that this identification or mirroring is part of the reason why some schizophrenic individuals don't really want to spend too much time with people because it's draining for them to engage in these sort of behaviors in order to pass as
Yeah,
sociable? Like,
I've certainly heard many people who identify themselves as schizoid describe that process and the exhaustion in it, and
mm,
also the uncertainty in it. If they're just trying to pass, get along, it takes a lot of energy, and it also puts them in the position of sometimes just trying to figure out what does everybody else see and what don't they see, because
mm,
schizoid people see a lot. They see a lot of
mm,
things going on that other people are defended against.
mm,
Um, and if you've had experiences of saying, well, obviously there's some anger in the room, and everybody else says, no, there's not, and treats you as being weird,
mm.
you may be right, but you're going to feel, uh-oh, I better be
Yeah.
careful what I say. Um, so that's a kind of constant pressure too in relating to other people. What what is visible, not just to me but to everybody,
Mm,
and what am I going to get a defensive response from? Schizoid
mm,
people don't have many defenses except for withdrawal, dissociation. Um, Whereas other people, they rationalize, they use denial, they use repression, they
mm.
use action formation, other defenses. But schizoid people are pretty undefended.
Right. Yeah. Do you think that, like, say there was a person and they were quite sociable when they were little, like up to about the age of 9 or 10, and they enjoyed interacting with people a lot, and then they got bullied at the age of 10, and then they started to withdraw socially and put up barriers, and they started to really dislike people as a consequence of that experience. Would you say that person could still come into the category of having schizoid adaptations?
Yeah, I would. I would. They may not have started out with a schizoid temperament, but if you get bullied enough, you are going to have that reaction. You're going to get very bitter about people and very reluctant to be part of any group.
Mm,
So yes, I would say that those are schizoid adaptations. The person may not have had a core schizoid personality, but
mm-hmm,
um, more commonly, people with schizoid personalities didn't have like a sudden traumatic experience at age 10. More
mm-hmm,
typically, they've had what Kahn called uh, microaggressions or micro traumas or um, sort of continuing minor traumatic experiences rather than one horrific social experience. But bullying is one of the most destructive uh, things that can happen to people. You can come from a very loving family, and if you're bullied, you
mm-hmm.
can be very damaged by it psychologically, especially if you're at the age when the social group starts to be very important, like 10, 11, 12, 13. Um,
Mm, right. And I was wondering, from a therapeutic point of view, what sort of therapeutic methods are used to assist people with schizoid adaptations in making progress in their lives?
well, I think probably the first thing is to establish a therapeutic relationship where the patient doesn't feel impinged on,
Mm,
where the patient feels the therapist respects their space, where the therapist is patient and doesn't have an agenda for the
mm,
schizoid person,
mm-hmm,
and and under most circumstances, I find that my patients figure out their own ways of making adaptations to life once they feel like they are. I can't say they don't that they feel totally understood because I don't think any human beings totally understand any
mm,
other human beings, but that the therapist is trying to understand their experience and has a grasp of the important elements of it. If they feel the safety that comes with that, then they're very good problem solvers.
mm,
Sometimes, if they have traumatic experiences like what you described with bullying,
mm-hmm,
some of the techniques that help trauma victims might be helpful to them, like EMDR, meditation, mindfulness. Those kinds of approaches are often helpful. Yoga, some of the calming um, disciplines are very helpful to
mm,
schizoid people. And artwork is very helpful to them. Um,
mm,
if they're at all artistic, especially, often they can draw what they're feeling before they can say it.
mm,
And very often in psychotherapy, it helps to work through whatever the patient's medium of communication is. I've worked with a couple of teenage boys who were very schizoid, who needed to talk for a long time about the video games that were consuming them because that's where their emotion was, and that's how they could make a relationship with me, is teach me about their video games. With some adult patients, they can't talk really directly about what they're feeling, but they can talk about literature and how Shakespeare's play moved them and what the themes were in the play, or maybe they do it through music or through the visual arts or some other mode of expressing themselves. But a lot of art therapists are pretty schizoid themselves and understand the process of
mm,
expressing through artwork what one can't yet express in words. And that helps schizoid people a lot. I think the primary thing, though, is for them to find themselves feeling increasingly safe with another human being who's genuinely interested not in changing them, but in feeling out what it's like to be them. and then collaborating with them respectfully to try to help them toward
Mm-hmm.
whatever the goals of the patients are. I mean, sometimes schizoid people come to a therapist saying, I'm very shy. Um, I want to develop a romantic relationship, but I don't know how to do it.
Mm-hmm.
I get too anxious when I'm approaching somebody that I'm attracted to. Um, and it takes a while to work on that. Very often, they first have to get safe with you before they're going to get safe with somebody that they're attracted
Mm-hmm.
to. And I think therapists sometimes find themselves having to remind a schizoid patient, I realize you have relaxed with me and you feel you understand yourself better. How are you doing with the goal that you came in with? How can I
Mm-hmm.
help you move more towards somebody that you're attracted to and try to build a relationship? And you might try to help them with that in any one of a number of ways, talk about different things you could say, or even role play it, or talk about what are the fears that get activated when they imagine doing it. But in general, I think the slower you go, the faster you get there. Because otherwise, you're going to overstimulate the person and they're going to pull back.
Mm. Do you think there are more therapists now that are becoming aware and finding ways to identify people with schizoid adaptations when they come into their practice?
I don't know. I don't know.
Mm-hmm.
Um, it, it used to be more common before 1980 when the DSM got all, you know, trait based and externally observation based.
Mm-hmm.
Um, I think it is coming back now because there's a need for it. You're
Mm-hmm.
not the only person who has contacted me saying they have some network of people who are
Mm-hmm.
seeking help with this kind of psychology.
Mm-hmm.
The fact that um, autistic people on the autistic spectrum,
Mm-hmm.
have come out saying there's nothing wrong with neuroatypicality. Um, I think that has had waves that have affected schizoid people. Schizoid people and autistic people have certain things in common,
Mm-hmm.
including a very great sensitivity and uncertainty about how to deal with social situations. In my experience, the main difference between them, and it's a critical difference, is that schizoid people really do get what other people are feeling and they read social cues accurately.
Mm-hmm.
They just have trouble responding. Whereas autistic people need to be taught what social cues mean. You know,
Mm-hmm.
a person on the autistic spectrum who is a parent, um, if you tell that person, children need to be held, uh, the autistic parent will say, "Oh, okay," and then they will hold their child.
Mm-hmm.
Um, they didn't realize that because there's some kind of intuitive empathic thing that doesn't come automatically to them, or they don't understand imagination. And they're very literal. I know a
Mm-hmm.
schizoid little boy who went, not schizoid little boy, an autistic little boy, excuse me, who's when a child comes up to him saying, "Grr, I'm a tiger," he says, "You are not a tiger." He just doesn't understand play.
Mm-hmm.
Now, a schizoid kid understands it. He may not want to participate in it,
Mm-hmm.
but he understands imagination. And a schizoid parent doesn't need to be told kids need to be hugged. He may or she may have trouble hugging their child, and have to push through a resistance to doing it. But they know that their kids like to be hugged. That's
Mm-hmm.
not where the problem is. The problem is in their getting exhausted and overstimulated easily.
Mm-hmm. Have you
So
helped?
I do think the normalization of different kinds of cognitive ways of being in the world has been helpful to all of us, not just the people in the autistic spectrum.
Yeah, I found that differentiation you made between people who are schizoid and autistic was helpful because um, there's a lot of people who sometimes have difficulty differentiating like which one they are.
Yeah.
And I agree with what you said. There is a difference, and I think the social cues is an important factor. I think, yeah. So what you're saying makes a lot of sense. Um,
I suppose there are some people who have both, but
mm,
it's important conceptually to differentiate because you don't want to lump anything together automatically. Um,
right. Yeah. And have you worked with schizoid parents, like to help them in their parenting process before?
yes, yes.
Mm,
Very often, a schizoid parent um, gives a child a little bit too much space, thinking that that's what they needed as a kid.
all
And then
right. Yeah.
the child can feel ignored. But I would say in general, I find schizoid people are pretty sensitive parents.
Mm-hmm.
I'm more likely to work with non-schizoid parents of schizoid children, trying to get them not to move in on their kid all the time and push them and criticize them for being too sensitive. And
Mm-hmm.
I find that if I coach the parent to just let your daughter take her own time to come to you, they're surprised that in fact she does come to them. You
Mm-hmm.
know, if somebody's saying, drink your milk, drink your milk, drink your milk, you know, milk
Mm-hmm.
is going to taste terrible to the child. But if the parent says, this is really good stuff, and when you um, get interested in drinking it, I think you'll really like it, and just leaves it
Mm-hmm.
in the atmosphere of the schizoid person, they will come to it. Um,
Yeah, that makes sense. Do you think that a lot of schizoid children might fly under the radar because they're so well behaved? Like,
yeah,
yeah,
yes, frequently. Although there
yeah,
are also schizoid children that are very, very disturbed and,
mm,
spend their time lighting fires and torturing animals because they're so enraged at the world. But that's not just schizoid, that's schizoid plus other kinds of disturbance.
like it could be coupled with maybe like antisocial
Yeah,
personality disorder or something like that,
yeah.
right? Okay. Um. Well, this is interesting. I'm thinking about a last question. Um. No, I think I'm going blank now. um.
Uh,
Yeah, I've asked a lot, and it's a lot. There's a lot of questions to think about here. You've been
well, let me
very
take the time to thank the schizoid people who have educated me about
mm,
their psychology. Because I do remember starting with one of my supervisors who described himself as schizoid, which was a new idea to me. And he was an artist, a sculptor, as well as a psychoanalyst. And I was trying to help this very schizoid 18-year-old guy. And I was, working at all kinds of things I was suggesting to him or interpreting to him. And my supervisor said, Nancy, this guy needs bromo seltzer, and you're trying to feed him pumpkin pie.
mm,
And I thought, oh, it's true. When I see people who are suffering, I assume they want me to move closer to them because that's
mm,
my psychology. I'm depressive, and people move closer to me, I feel safer.
mm,
But this supervisor taught me from his own experience, give him space, he's feeling overfed, you know,
mm,
bilious with people putting too much in him. Stop trying to feed him. And it was a revelation to me that there were patients who were comforted by space rather than comforted by closeness. So
mm,
that was the beginning for me of understanding. It was so valuable to me as a therapist. Um, and I can think back to a few people that I could have helped more if I had understood this even earlier in my career. So I do hope you get the word out.
Mm-hmm. And because you mentioned you was married to someone, to two husbands that
Yeah, my
um
my first husband who died almost 20 years ago, and my current husband, um, both wonderful men, um,
mhm,
both identified more as schizoid.
right, okay,
And I loved their minds because they were very creative,
mm-hmm,
and they had very good hearts and real sense of what was important in the world. And they were unpretentious and not narcissistic. And
mm-hmm,
I really enjoy people like that. Um,
mm. Yeah, it sounds like you've got a deep appreciation, and I think maybe because you're very understanding of the schizoid individuals, because I think that really, I think that we do want to be understood for our minds, you know.
yes,
Mm, yeah.
yeah.
Well, it's been a pleasure to talk to you today, and you've given me lots of insight to process, and yeah, and I like your energy, and I think when you're talking about therapists and energies, and that's important to a schizoid seeking therapy, I agree, because I think energy means a lot to us. It really
Yeah,
does make a difference. It's the environment that we sort of swim in, you know? And
I
so,
agree. Yes.
yeah. So thank you for bringing your energy. And
Well, thank you, Kenzie. It's been
okay.
a pleasure.
All right then. And goodbye.
Bye bye.